Have Dr. James Stevens back with us today in the studio to continue our discussion. And Dr. Stevens has a great background in sports-related injuries, activities, performance. And welcome, Dr. Stevens.
Thank you very much.
Perhaps you could just tell us a little bit about your experience and give us some of that background.
Well, I have a fellowship trained in sports medicine many years ago at the University of North Carolina. And I've had the good fortune of being the team physician for the Carolina Hurricanes in the National Hockey League for the last 25 years. And I have a wonderful Stanley Cup ring that the team gifted me to show what my experience adds up. But I've had a lot of exposure, and I bring that to my general practice as well, right, in the value of sports activity, exercise, right? Everything, of course, from world-class athletes to, octogenarian that wants to run a 3K for charity reasons and everything in between.
Nice. And so I know you don't only talk the talk, you walk the walk yourself. So you're a triathlon athlete, of Ironman?
Half Ironmans, if we're going to get real specific, and everything underneath, right, from sprints on up to halves. And I'm maybe ADD. And I love having a choice of running, swimming, or biking and training. But it's really, I used it as a methodology to keep myself moving on a pretty much daily basis when you're training for a half Ironman, if you will.
Mm-hmm. Well, so from the standpoint of hyperbaric oxygen then, you've applied it. Obviously, you're the medical director at Ex DaVita, and so some of the athletes you've talking about have had hyperbaric treatments there as well as you have a chamber. I
do
in your office.
Yes.
And so can you speak to some of the benefits of that as it relates to injuries?
Yeah. I've been involved in hyperbarics for 14 years. It captivated me that long ago in its ability, by understanding the science of hyperbaric oxygen and cellular injury, you begin to appreciate how they align quite nicely. Then it's a question of education, its application, its accessibility. But for years, right, I have been able to at least promote to my patients, as you know, virtually every injury, right, is amenable to hyperbaric oxygen. And why is because if we understand the science of hyperbarics in a nutshell, and you know it probably better than I do, oxygen is the key element besides glucose to create energy, right? Those two things. Now, it's more difficult to go into the entire Krebs cycle and all that's involved in a cellular generation of energy. But the basic formula is oxygen plus glucose equals energy. When you look at an injury of any type, a muscle strain, a sprain, a fracture, surgical, laceration, head trauma, we'll talk about that. All cell injury can benefit from oxygen delivery. I can't think of a cell injury that wouldn't. Right. If you look downstream from an injury, you send how many people have sprained their ankle, right? Ankle swollen. Will compression help that? We've always said it would. Well, what if you could wrap the body with a certain amount of pressure and deliver 300 times more oxygen at the cellular level than you could get in injured tissue, breathing room air at sea level? And so that's my focus in sports injuries. And I have, story after story that we could go into. They're very exciting in some cases, but the reality is we take a head injury. We now know, right? You and I and the rest of the hyperbaric world, right? Look at Dr. Paul Harch's work, right? We know that oxygen under pressure in head injury is necessary, actually, right? If we look at sprains, strains, I see them all the time. I work in a very violent world, right? You put a 200-pound man on an eighth of an inch blade at 30 miles an hour and trip them into the boards or slash them, right, or hit them with a puck at 95 miles an hour, you're going to have tissue damage. Right? And in a perfect sense, I'd love to put everybody into, right, an injured cell into hyperbaric oxygen.
So from the standpoint of, we take, for example, a sprain, and you have access and you were able to get the hyperbaric oxygen therapy. Is there an acceleration of the healing? Can we quantify that?
Yeah, well, I think this is where in professional sports, right, it becomes perhaps a different priority. It's very true that you could say, I'll take my high school soccer player who just sprained their ankle, and it will get better. It will, right? If it's not rehabilitated correctly, it might be sore for months, an entire season. If it's rehabilitated correctly, it might be better in 2 weeks, right, at a cellular level, right, at a symptomatic level. Well, where does hyperbaric oxygen play? It accelerates all wound healing, right? And so when time is of the essence and the accuracy of the repair is of the essence, there's probably little argument that hyperbarics would help everybody. It may not be practical for everybody, right? But it doesn't mean it's not inapplicable to everybody.
Sure. So, of the essence, if it's me, it's of the essence. I want to get in there because I don't want to deal with that pain for the whole year.
Absolutely.
And then sometimes because of the pain you're feeling on one side, you're actually doing damage to the other side. So we see that as well. So I think for the spirit of humanity, this should be accessible. People should have access to it. It would be great. I know that there's no way that could happen today because there isn't that there aren't that many chambers,
right,
quite frankly, available. So maybe someday.
Well, I think that what we've come to accept, rightfully so, is that there is a natural healing process. Mm-hmm. Let's call it 2 weeks. And then there are those that would say, but if I could do it in a week, why wouldn't I? At the professional level, we know why, right? Because that's a very valuable element of time in that. In everyone else, it becomes maybe a little more subjective. It's not that you won't heal, but you will heal faster and you will heal better, if you will, if you have that application for it. And so I will see something like a senior in their last year in the state championships, right, who in the quarterfinals sprains an MCL or a medial collateral ligament of the knee, or their ankle, right, or their elbow in a wrestler going to state championships. And they'll find and seek out hyperbarics if they have education about it. And that's part of what you and I really also believe strongly in, which is how do we get this message out to everybody so that you're aware that there's this capability, if you will. And then where's the accessibility that comes with that, et cetera, et cetera.
Well, one of the areas that I've read a little bit about is that hyperbarics, can work exceptionally well when it comes to ligaments and tendons. For whatever that type of tissue responds much more readily, maybe because it's an inflammatory, driven injury.
Perhaps.
More so. There's no physical repair that might be as extensive as like a broken bone or something. So the timing maybe isn't as long. But is there a reason?
I think that basically, if you look at a muscle tear, muscle is heavily supplied by blood. Right, the blood supply in muscle is much different than a tendon or a ligament. And blood supply is where that healing is going to take place. Well, in hyperbaric oxygen, you could almost say it's independent of blood supply. We know that what you do is under pressure, you diffuse oxygen into plasma, right, into the extracellular matrix at a tremendous gradient compared to normal atmospheric pressure and normal oxygen. That's why that tissue is going to heal faster.
Because you're getting oxygen to it.
Yes.
There normally isn't very much.
Correct. And the signaling of that oxygen under pressure is very high in concentration compared to a normal healing process. That normal healing, that signal is anti-inflammation, right? Improved ATP or energy production, right? And so that ligament or tendon is going to heal at a faster rate.
Interesting. And I have a personal friend that had a bad ankle sprain, and she was put in a boot, a cast, and they said 4 weeks to come back,
Yeah.
and they'll remove the cast and put on a soft cast.
Right.
And a week later, the cast was getting so loose that she went back in, and they put on a soft cast and wanted to know what did she do. And she was doing 2 hyperbaric treatments a day for 5 days.
Yeah.
And then inflammation was completely gone.
Right.
Healing had occurred to an extent where she could basically walk in a soft cast. And is it that seems to me, is that common to see that sort of like acceleration?
Oh yeah, well we know it's accelerated, and I think when you bring 2 sessions a day into play, what's probably happening is very intriguing at a scientific level, right? It's called the hormetic effect, right? So there's hyperoxygen and relative hypoxia, which is not so evident at first, because when you go back out of the chamber, within hours, you've returned to normal oxygen level. But those cells were just exposed to very high concentrations. So this tandem back and forth of hyperoxia to relative hypoxia induces, right, these phenomenal cellular changes of repair and response that's evolutionary based, right? Mm-hmm. It's pretty fast. And I think that's what's happening when we do 2-a-days, right? There's some newer protocols that you'll see out there which are doing air breaks, put air brake. In 1 hour, what you're really doing is the same thing. Hyperoxia, hypoxia, hyperoxia, hypoxia. I'll talk about that more when we talk about concussions.
Concussions, yeah. So from the standpoint of sports injuries, we'll come back and we'll talk about concussions in a separately.
Sure.
So we'll keep that separate. And so one of the areas that you see sports athletes looking at hypoxic, putting themselves in a hypoxic environment. So oxygen depletion,
right?
Like at the top of the mountain,
Yeah.
kind of, and then the opposite. And hyperbaric is of course increased pressure.
Right.
So there's less pressure,
Right.
less atmosphere above us,
Yeah.
right? So
Right.
we're at 1 atmosphere
Yes.
here, relatively sea level. So from the standpoint of performance in athletics, there's a lot written about that. And so
Sure.
what can you share with us about regarding that?
We're really addressing hormesis, or the hormetic effect. Think of burn by fire or burn on dry ice. A thermal burn is a thermal burn. It's an extreme in one direction or the other. So the adaptive mechanism of the cell when you do hypoxic treatment is to reduce oxygen and then return to room air, right? The cell responds to that by seeing, ooh, I'm starving, now I'm not. I'm starving, now I'm not. Almost identical process in hyperbarics, right? Ooh, I'm super saturated, I'm starving. Well, no, you're really not. You're back to normal. But it's the impact of that contrast that stimulates the cell repair, stimulates the cell mechanisms, right, to improve. And so I see them as very similar. If you're going to do a restriction, limb restriction, hypoxic therapy, it's in some ways more accessible, but it's the same process as the cellular response.
Now you don't have that tremendous increase in oxygen in the plasma.
Correct.
So where you have this, this anti-inflammatory response,
right,
that occurs, or you have this, the gene. You have this impact on your genes where your anti-inflammatory genes are upregulated,
right,
and inflammatory downregulated. Is that something similar when you do through the hypoxic?
Yeah, but it's slower, right? It doesn't have the same bang, if you will, right? But it's inducing that change, that contrast is inducing those stem cell activation, neurogenesis, angiogenesis. I think of hyperbarics, right, as sort of the creme de la creme, right? It's a great way to get the hormetic effect. And you're doing it by increasing oxygen delivery. You're accelerating the cell's ability, right, to respond.
So when you look at, some of these mountain villages, high up in high altitudes, that I remember hearing or watching a documentary on that where the inhabitants had larger hearts at the higher elevation. And that's the indigenous, of course, they're there all the time. And so that's because of the lack of oxygen. Their hearts need to work harder so they're stronger. And they can climb to the top of the mountain, and they're not out of breath when you're sucking wind, and
Sure.
And so long term, does your body actually change? Will it change, or that's
in relationship to hyperbarics?
Well, either way, more oxygen or less, or we're not talking about such a steady regimen of it that you're really not going to have permanent impact. Is there a permanent impact?
Well, we see, for example, if we look at Everest and we look at what happens to climbers versus Sherpas, right? If you look at their hemoglobin and hematocrit, right, which is their blood iron ability to carry oxygen, their hematocrits are very high. More iron is stored per red blood cell because there's less oxygen, right? And that is an adaptive mechanism, right, that really affects the entire body, right? The load of expanding your red blood cell mass, right, will change some of the dynamics of your heart as well, right? I don't think of those as detrimental. They're just adaptive processes, right? In hyperbaric oxygen, we're at the other end of the spectrum, right? We're not going to increase our hematocrit, right, because we're going to go through plasma and deliver oxygen to every cell to allow it, right, to be optimum in a very different state than when you're breathing ambient air.
So from the standpoint of people thinking, well, you've been doing hyperbaric oxygen for 40 years. I know in the UK people have MS and they have
Sure.
they have a regular regimen. There's some 70 clinics focused just on MS because they stopped its progression with hyperbarics. Does that change something in them that makes them need it more? Is there a long-term, negative effect? You're doing it too much, you need to stop.
Well, I think that, and we'll talk a little bit more about longevity, right? But the Israelis just came out within the last 2 years with some elegant studies, right? Long-term use, chronic use of hyperbaric oxygen, right? Longevity markers are extended. So I don't see a logic that would say using it long-term is detrimental. I think you're optimizing the cellular milieu or the cellular state for energy production, right? What can be wrong with that? Right?
Yeah, so there should be no concern there. Okay, from a personal question.
Yeah.
So it's winter, getting close to winter here.
Yeah.
Anyhow, we're in mid-December, and the water is pretty cold.
Yeah.
So turning the shower on cold.
Yeah.
You adapt to it.
Yeah.
You sort of
Right.
it's first you take a deep breath.
Yeah.
Okay. And so every morning I suffer through that.
Yeah.
Is there a value?
Well, we think of that in heart rate variability. We think of that in vagal stimulation, the vagus nerve, and the response, the adaptive response of the body. There is a benefit. 2 minutes should be 2 minutes of ice cold water.
That's it. 2 minutes.
You hear about these body cryotherapies, right? 2 minutes, minus 80, right? Ice baths, right? And there are people that are doing, look at Wim Hof. If you want to research somebody who has done a lifetime of research and experientially in cold, he's the Iceman. Right?
Well, you see him on Everest in a pair of shorts at the top, sitting in the snow, right, with his legs crossed.
Yeah. He's been known to run a marathon in Antarctica, right?
Antarctica.
Yeah. And survive it, where truthfully, 99% of the human population would expire before they got back, right? In trying to accomplish that feat.
Well, it's not even above zero in the summer.
No. But what he's shown is that the body's adaptive capabilities through chronic cold exposure on a daily basis improves your immune system. It reduces inflammation. It settles down, right? The contrast between the parasympathetic rest and restore or rest and digest system and fight or flight, right? And I think that fight or flight we all have. That's modern man. We all have those challenges. But we tend to minimize the value of something like a 2-minute cold shower, right? Meditation, deep breathing, right? Box breathing, they call it. Right? These are all things that, and by the way, hyperbaric oxygen, right, also lends, right, to that vagal stimulation, if you will, or benefit of how to help my fight or flight stay in balance.
Mm-hmm. Well, one thing I noticed with the cold shower is I don't really need coffee. You're instantly awake.
Sure.
Yes. So is there anything else that you would like to cover regarding, sports injuries?
Well, I get a lot of questions about the use of hyperbarics on a regular basis for my athletes. We see some elite athletes promote this. They have it in their home, chambers in their home, right? And what is the benefit of that? And should I be the one doing it? And, how do I go about doing it, et cetera, et cetera? And there's controversy that surrounds that because it's pressurized, right? You're by yourself, et cetera, et cetera. But the reality is it's extremely safe, first and foremost. It is beneficial. So sports-related recovery, right? Pre-competition, right? And when do you do one or the other? There's no right or wrong in that argument, right? But recovery is typically what is the dominant question,
mm-hmm.
right? I have an 85 game or 84 game in our league, and boy, by March, I am like toast, right? Could I do hyperbarics, right, every day after I get home from the game? Yeah. Would it help? Yes, it would. Right? It would help your recovery. It would help you at a multiple levels of energy production, et cetera, et cetera. So I would say, one, in the sports performance aspect, right, hyperbarics has a place, right, particularly in recovery.
After the game.
Yeah.
You get beat up and
yeah.
bruises go way quicker. And
correct.
I think a lot of the NFL players have as we call them, the soft chambers in their homes.
Correct.
And that number 5 years ago was 500.
Right.
When I was exposed to it, and they had a list of all the ones that had it, and whether they still use them every day or not. In fact, at the Hyperbaric conference, you spoke with a number of the retired NFL players
right.
regarding that. And so there was a story about a Canadian hockey team that they found the value of hyperbaric oxygen, and they had some massive chambers, and they were treating the players every day.
Mm-hmm.
And that worked great. They were undefeated for 2 or 3 weeks, and then all of a sudden they started losing steam. Like they were adapting to all that oxygen that was always available. And so when they traveled, they didn't have that with them.
Yeah.
And so they didn't have all that oxygen in their plasma going into the first, second period. I think 4 hours, it's a straight line.
Yeah.
It's out of your system at that point. And so it seems to me that the body can get used to it and feels really good because people sleep really well, right? After that night, they sleep really
Absolutely.
well. And maybe they were feeling that on the ice. I don't know. But they stopped using it. I don't know if you've heard that story, but
but I can understand, again, and we can always come back to what we know as the hormetic effect, right? So time on, time off. Time on, time off. And anything that you do on becomes relative to cellular adaptation, right? There's the upregulation of enzymes and there's the downregulation of enzymes. Upregulation of receptors on a cell and the downregulation. So having none ever, right, would be common for more than 99% of the world. But having some, but not having it all the time is probably the way to leverage, right? That beneficial cellular adaptation instead of overdoing it, so to speak.
Mhm. So if you're fighting inflammatory disease or something, then it can be beneficial. At some point, probably good to take some breaks. And
Right.
I've heard the 5-day a week and the weekend off.
Yeah,
while
that's how I do it in my clinic,
you do.
right?
Yeah.
It's precisely that.
Yeah. It's not open on the weekends for that
Right.
reason.
2 days off, and you're ready to go again.
Yeah, that's great. Well, again, appreciate you coming and covering this
Thank you for
topic.
having me.
And with all your experience, I think it's valuable for anyone listening to this to get some information and to begin to look deeper. You can look up injuries, and there's lots of studies, I think, out there that have been done. I'm not sure about the clinical review or clinical peer-reviewed studies that you often hear about, and the need for that is, I don't think it's there because the baseline or the placebo group isn't getting hyperbaric, and that's everybody.
Right.
And so
Right.
if we see people healing faster, it's
Yeah.
just like one of those cases where I think just a study looking how fast people are healing is a good study.
I do think that there is sufficient evidence-based data to show that injuries, broken bones, torn muscle, sprains, right? We certainly know the data in concussion, but I think there's sufficient data to show fractures are accelerated healing, right? And how much data you need to be convinced, right, is relative to whoever's asking the question.
Well, if it happens to me, I'm in.
I'm in,
Yeah,
right?
I
I
mean,
think there's sufficient data.
I've seen
right?
enough. Yeah.
right.
We
Correct.
don't need FDA approval
Right.
on an injury.
That's right.
Just treat, and it's like one of those things that you just do it. And so if I'd like to end this, if we could, with similar to our last conversation, is if there's one thing that a miracle that you could ask for, could be personal, can be global, that you could get, just that one miracle, what would it be right now?
Well, I'd probably go back to our last discussion, right? My miracle is that we come to accept, and I'll apply this within the realm of sports in this sense. We all must move our bodies. And how we can educate ourselves to not sit in a chair for 12 straight hours, 14 hours, go home, watch TV, go to bed, get up and do the same thing for years on end and expect not to be injured. We know the effect of hyperbaric on injury. We can assume, right, it's a hand in glove. But why we get injured, right, is partly what I come to work every day, right? My practice is about wellness. It's about proactive and not reactive. You have to have the tools, and we have the tools, right? But I'd say my prayer would be everybody understand the value, right, of movement in their life.
Well, let's ask the Lord to give us that.
Let's do it.
Yeah, Heavenly Father, if anyone listening to this discussion with Dr. James Stevens hears that loud and clear, to stay active and avoid injury. In the case of a severe injury, seek out hyperbaric oxygen. It's going to help you heal much faster, and that hopefully you hear that message and heal quicker. In Jesus' name, amen.
Amen.
Thank you, Dr. Stevens.
Thank you very much. I
Hopefully
enjoyed
get you
today.
back real soon.
Yeah, okay.